I'm Nima Rajan. Prime Minister Justin Trudeau says he isn't following Washington's lead and ordering the families of embassy personnel in Ukraine to leave. But he says several contingency plans are in place to protect Canadian diplomats and their families as concerns rise about a possible Russian invasion. Mr. Trudeau says Canada is extremely concerned about the Russian aggression, but once again did not answer questions about Canada sending weapons to Ukraine or extending the Canadian training mission in the country. A convoy of unvaccinated truckers is on its way from BC to Ottawa to protest the federal government's cross-border travel vaccine mandate. However, they do not have the support of the Canadian Trucking Alliance, which argues that this type of demonstration isn't a safe or effective way of resisting the policy. The convoy will be joined by fleets of other drivers for a rally in Ottawa on Saturday. The Alliance says that the vast majority of truckers are vaccinated and that it strongly disapproves of any protests on public roadways, highways, and bridges. Nunavut has signed on to the federal government's affordable childcare program. This leaves Ontario as the only jurisdiction that hasn't joined in. The $66 million deal will cut childcare fees in half by the end of this year and create 238 new childcare spaces in the territory by 2026. Prime Minister Justin Trudeau says Nunavut's daycare fees will fall to $10 per day by March 2024. A study on the indoor air quality and housing conditions in 4 First Nations in the Sioux Lookout region of northern Ontario has found some serious widespread problems. Researchers are linking the elevated rates of respiratory infections and wheezing they found in young children to poor conditions in their homes, including mold issues. The study on the homes where 98 Indigenous children aged 3 or younger lived found 85% didn't have controlled ventilation, more than half had broken windows, and 44% had water seeping in through the walls. A Florida man charged with transporting or attempting to transport illegal migrants is due in court today for a preliminary hearing. Steve Shand was charged after 4 people, including a baby, died of exposure while trying to walk from Manitoba into the U.S. last week. Investigators believe they were part of a larger group of Indian migrants. This includes 5 who told U.S. Border Patrol agents they had been walking through the snow and bitter cold for more than 11 hours. Major General Danny Forten returned to a Quebec court today on a charge of sexual assault. This is related to an incident that allegedly happened in 1988. During a brief hearing, he opted for trial by judge alone. General Forten was abruptly removed from his job as head of Canada's COVID-19 vaccine rollout last May. And he is also fighting for reinstatement to his former role with the Public Health Agency of Canada or an equivalent position. General Forten has maintained his innocence and accused the Liberal government of turfing him for purely political reasons. An organization representing Ontario home care providers says about 4,000 nurses have left the sector since the pandemic started. Before the pandemic, Home Care Ontario says providers filled requests for care about 95% of the time. This is a number that dropped to just 56% as of the end of last year. It is pointing to the impact on Ontario's hospital system, with provincial data indicating 582 patients would be eligible to leave hospital with publicly funded home care if the resources were available. Well, starting today, Quebecers planning to shop in person at big box and other large-scale retail stores across the province will have to show proof of vaccination. The new rule applies to stores with floor surfaces of 1,500 square meters or more, but not to those that primarily sell pharmacy or grocery products. Premier François Legault is targeting unvaccinated residents in an effort to curb COVID-19-related hospitalizations. Toronto-based Freshii has reached a deal that will see its Energy Bite snacks be available in about 600 7-Eleven Canada stores until March. 7-Eleven Canada says the partnership reflects its pursuit of innovative ways to cater to a new generation of shoppers. Freshii snacks will be available in 7-Eleven stores and will also be available through delivery services. The Dow Jones Industrial Average dropped more than 1,000 points earlier today, but is now down about 465 points as markets on Bay and Wall Streets plunge. Investors are worried about potential inflation-fighting measures from the U.S. Federal Reserve and that Russia might invade Ukraine. The Toronto market was down about 275 points in mid-afternoon trading. The benchmark S&P 500 is on track for a correction, a drop of 10% or more from its most recent high. All right, we'll be right back after the break with a look at equalization. We'll have an interview with Dr. Jim Mason after the break, so stay with us. We'll be right back. On October 18th last year, 62% of Albertans voted in favor of removing the Equalization program from Canada's Constitution. Equalization is a federal program for addressing fiscal disparities between provinces. This is to ensure that provincial governments can provide reasonably similar levels of public services at reasonably comparable levels of taxation. The principle of equalization was entrenched in the Constitution in 1982, but the funding formula can be changed by Parliament. And one new proposal published in the C2C Journal suggests Parliament do that. Well, joining us now to talk more on this is Dr. Jim Mason, the author of Too Hard to Kill, Towards a Fair, Equitable, and Science-Based Equalization Program. In addition to writing for C2C Journal, Dr. Mason has a PhD in experimental nuclear physics and served 37 years with one of Canada's leading defense electronics companies. He joins us now. Dr. Mason, welcome to Forum Daily.
Thank you very much. Pleased to be here.
So what would you say are the main takeaways from your article in the C2C Journal?
Well, I guess I'd say it's a simpler formula. It's got very simple metrics to use to measure the two things that you mentioned are part of the equalization program that make it very easy to compare the situation across provinces. And it just gives a very reasonable and I think fair and equitable outcome.
And how does that compare to the equalization program that's currently being used?
Well, that's a little bit hard to do because the current equalization program is pretty complicated. They have a very complex formula. But basically what it does is it compares each province to a national average. And everything that's below the national average, any province that's below the national average gets topped up with an equalization payment. Now, there are obviously always going to be provinces below the average. But if you take a more, if you like, holistic view and look at the comparison between provinces, then you really need to get beyond just the average and look at how they're distributed across the average. With the present approach, you could have a province that's $1 above the average and another that's $1 below the average. And the one that's below the average would get an equalization payment, but the one that's above would not. So what this proposal does is it describes a different way of making that reasonably comparable decision that is a standard practice in the sciences, actually, for making exactly that same decision.
All right, Dr. Mason, well, why do you think the formula needs to be changed in the first place?
Well, I think the current formula is generally perceived to be unfair and inequitable by a fairly significant number of the provinces. And it's so complicated that it's really hard to get in there and make a change that's going to address these issues. I took the approach that really what to do was go to the constitutional requirements and work from there to devise what I think is clearly a fair, equitable approach. Very simple to understand.
All right. Well, we did mention in October, Alberta held a referendum on this equalization program. Tell us a little bit more about why Alberta held this referendum in the first place and what the federal response to this vote was.
Well, I think you'd really need to ask the people in Alberta why they did it. I don't live in Alberta, but my own impression is that what they really wanted to do was indicate very unambiguously that they don't like the program. They've asked to have it removed from the Constitution, but I think realistically that's unreasonable, never going to happen. But I think they'd be happy if we could change the implementation so that they recognize it as being more fair and equitable.
All right, Doctor, just about a minute left here, but I guess one of the bigger questions would be, is there a realistic way for the federal government to maybe address the concerns of Albertans while also addressing fiscal disparities between provinces?
Well, one of the interesting things that came out of this, excuse me, I worked through an example using the 2017 provincial fiscal data and found, quite surprisingly perhaps, that if you use own source revenue per capita, which is the amount of money that a province would have from its own resources to spend on its public services, there's not a lot of fiscal disparity between the provinces. They're all pretty much the same. And they get that with pretty much the same levels of taxation. So I think this idea that there's a huge fiscal disparity is a bit of an urban myth that's grown up over the years.
All right, Dr. Mason, a quick 30 seconds left here, but where can our viewers go to read your article and find out more about the federal equalization program?
Well, as you mentioned, it's been published on the C2C Journal website. That's C2C with 2 being the number, journal, all one word, .ca. And it's currently the one that seems to come up as soon as you get to the website.
All right, Dr. Mason, thank you again for joining us today on Forum Daily.
It's been my pleasure. Thank you very much for having me.
We'll be right back after the break. As Canada continues its battle against the pandemic in 2022, a new survey suggests that Canadians have had enough, at least when it comes to their mental health. A recent study by the Angus Reid Institute finds the population is frustrated, fatigued, and anxious, while 1 in 3 Canadians say they are struggling with their mental health. According to the research, this represents a jump from a quarter of the population in November, which was before the Omicron variant was dominating infections. Meanwhile, 1 in 3 Canadians say depression and anxiety are the major problems within their social circles, while another half say they have been exposed to this issue. Well, joining us now to give us deeper insight into this pandemic-fueled mental health crisis is the National CEO of the Canadian Mental Health Association, Ms. Margaret Eaton. Ms. Eaton, welcome back to Forum Daily.
Thank you so much for having me again.
So let's start with how the pandemic itself has impacted mental health during the last 2 years.
It has not been good. We've been tracking this since the beginning of the pandemic, and the numbers have stayed fairly consistent, and they're very close to what Angus Reid has found, that our numbers show 41% of Canadians have seen a decline in their mental health. And that's consistent with what we're hearing on the ground. There are CMHAs in 330 regions across Canada. And one of the branches was telling us they feel like it's a whiplash effect, that things were getting a little bit better last fall, and then Omicron hit, and the phones started to ring across the country. So we know Canadians are really hurting right now.
And what would you say are the key takeaways from this recent Angus Reid study in particular?
Well, the Angus Reid study was so interesting because it said nearly half of Canadians say they're tired, they're frustrated, they're anxious, and 1/3 feel that their anxiety and depression is a major problem. It was interesting that 7% of Canadians say they're barely getting by when it comes to their mental health. And the number of people who were experiencing mental health issues had more than doubled since any other measure at any time that Angus Reid had done since October 2020.
And it's also interesting that the provinces of Ontario, Saskatchewan, and Manitoba were highlighted as feeling the most of this mental health strain. Why do you think that's the case, ma'am?
We were wondering if that was because of the recent lockdowns that those provinces have experienced. We know that lockdowns have been very hard on people. It's hard for small business owners. It's been very tough for people who live alone and are more isolated. And it's been particularly hard for parents if their children have been kept home from school and they've also been trying to earn a living. So all of those circumstances just add up to worse mental health.
And meanwhile, all across the board, we're seeing Canadian professionals in the medical field, education, and frontline workers really feeling the mental health hit. We're seeing a lot of worker burnout. We're seeing people leave their jobs. Can you tell us how this is likely going to impact those professions in the long run?
Well, we're very concerned about the impact for all Canadians in the long run, but it's been especially tough for hospitals and healthcare workers to actually find workers. We're also seeing this in the restaurant industry where people are leaving because there are no jobs there anymore, and they're not going back. They're finding jobs in other places. And we've seen in the mental health field, because there's been so much demand on the services for mental health care workers, that there are similar concerns about longer term shortages, especially as we see governments try to increase funding for mental health care. We're going to have a body of workers who can actually help us deliver on these increased services.
And on that note, what would you say are some realistic steps that the federal government can take to really address this issue across Canada?
Well, we were so happy to see that the federal government has created a minister for mental health and addiction, which is the first in the history of the federal government. The federal government has also promised a Mental Health Transfer Act, which is basically their way of ring fencing an amount of money. It'll be $5 billion over the next 10 years of spending just for mental health. We know the federal government is the largest funder of healthcare across the country, but oftentimes they do not make any standard or have any criteria for how that money should be spent on mental health. So this is the first time that we've seen them actually say we must address this mental health issue by clearly designating this funding for mental health. So we hope that that will increase access to care and reduce waiting lists across the country.
Well, we'll definitely have to keep our eyes on that, ma'am. A quick 20 seconds left here, but what are some resources that people can utilize right now to improve their mental health during the pandemic?
Well, if you are concerned, we urge you to get in touch. So go to our website at cmha.ca, and you'll see a number of different resources for dealing with things like the winter blahs, the results of the pandemic, but also you'll see access to free mental health care services.
British Prime Minister Boris Johnson says a Russian invasion of Ukraine is not inevitable, but that, quote, the intelligence is pretty gloomy. However, he says he believes that sense can still prevail. Britain and the U.S. are withdrawing some diplomats and dependents from its embassy in Kyiv as tensions soar between Russia and the West. NATO is outlining potential troop and ship deployments, and Ireland is denouncing upcoming Russian war games off its coast. The United Arab Emirates says it intercepted 2 ballistic missiles targeting the capital of Abu Dhabi earlier today. Yemen's Houthi rebel militia has claimed responsibility, saying it had launched attacks targeting both the Emirates and Saudi Arabia. The attack on Abu Dhabi follows a similar one last week that killed 3 people and wounded 6. China has flown 39 warplanes toward Taiwan in its largest sortie of the new year. This continues a pattern that the island has answered by scrambling its own military jets in response. Taiwan's defense ministry says the formation Sunday night included fighter jets and electronic warfare aircraft. It said Taiwan scrambled its own jets and tracked the People's Liberation Army planes on its air defense radar systems. Chinese pilots have been flying toward Taiwan on a near daily basis in the past year and a half. Over a dozen mutinous soldiers say they have detained Burkina Faso's president. Appearing on state television on Monday, they said that a military junta now controls the country following a day of gun battles in the capital. The military coup is the third of its kind in West Africa in the last 18 months. This is creating perilous upheaval in some of the countries hit hardest by Islamic extremist attacks. A spokesperson said that the Patriotic Movement for Safeguarding and Restoration would work to establish a calendar acceptable to everyone for holding new elections. All right, well, meanwhile, thousands of Sudanese have taken to the streets in the capital of Khartoum and other cities. They are continuing relentless anti-coup protests that have rocked the country since a military coup 3 months ago. Activists say security forces fired tear gas to disperse protesters in several locations in the capital on Monday. Those include the area around the fortified presidential palace, which has seen clashes in previous rounds of protests since the October 25th coup. Police in Heidelberg, Germany say 1 person was killed and three others injured when a man armed with a long-barreled weapon started shooting in a lecture theater. Police say the gunman is dead after the shooting, with a spokesperson saying he killed himself. Police say that the shooter was acting alone and that there is no further danger. The shooting happened in the area of Heidelberg where the city's university is located. The World Health Organization is warning that conditions remain ideal for more COVID-19 variants to emerge. And Director General Tedros Adhanom Ghebreyesus says it's dangerous to assume Omicron is the last variant or that we are in the end game of the pandemic. Dr. Tedros told a WHO executive board meeting that ending the acute phase of the pandemic must remain the collective priority. China is testing millions of people and imposing new measures after a cluster of COVID-19 cases surfaced in Beijing. With just 2 weeks to go before the opening of the Winter Olympics, officials have also announced that anyone who buys or who has bought fever, cough, or certain other medications in the past 2 weeks must take a COVID-19 test within 72 hours. Two moderate earthquakes shook southwestern Haiti this morning, one measuring magnitude 5.3 and the second at magnitude 5.1. The quakes caused panic and prompted schools to close as a precaution, but there were no immediate reports of damage. On Friday, Canada announced that it was committing an additional $50 million in humanitarian aid to Haiti. It is still trying to recover from a 7.2 magnitude quake last August that killed more than 2,200 people. 4 Japanese aircraft have left Australia to deliver more vital aid to Tonga as the Pacific nation deals with the aftermath of a volcanic eruption and tsunami. The Australian Defence Department said the Japanese planes left an Australian airbase on Monday to make the 2,050-mile journey east to the islands that were devastated by the January 15th twin disasters. 8 flights from Australia, Japan, and New Zealand also carried food, water, medical supplies, and telecommunications equipment to Tonga over the weekend. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could always visit our website at thenewsforum.ca and follow us on our social media handles on Facebook, Instagram, and Twitter. You also have the option to watch all our commentary programming and interviews on the News Forum YouTube channel. All right, thanks for joining us on Forum Daily News. Take care, Canada. We'll see you next time.